So Texas received 332,750 doses for this week from the federal government. At Abilene Taylor County Public Health, we have received our 1,200 doses again. It's the Pfizer vaccine. We'll be holding our mass vaccination clinic on Friday at the convention center, and it's going to be 8 a.m. to 6 p.m. Again, it is by appointment only. Staff is currently reaching out to all of those people who are signed up to get them scheduled. I will say that yesterday, I think they had called like well over 700 people and only got like 300 scheduled. So there are a lot of people who are not answering their phones. So if you have signed up, we need you to remember that the call may come from a number that either says it's a private call, that it may be blocked. It may say no caller ID. It may look like a cell phone number. It may be a 325-437 number. A lot of our phone extensions at the Public Health District are going to show up as a 437 number. So, and then there's some who are reporting that it is labeled spam risk. So if you are signed up on our waiting list and you're awaiting that call, you need to make sure you're answering all those calls. So we're still working to try to fill that schedule for Friday. With this 1,200 doses, since it is the Pfizer, and you probably saw the news that Pfizer officially increased the number of doses that you could get out of a single vial. Before it was 5, but they were putting a little bit extra in there to make sure that you could get adequate doses out. They've actually officially changed it to 6. So we anticipate that we will have some additional doses. We did verify with Hendrix, since they are the other entity that has administered Pfizer vaccines in the past. Depending on what gauge needle you use and all of that, they were able to get extra doses out of the vials. And so we're just going to go ahead and be scheduling the additional appointments, anticipating that we would administer closer to the 1,400 doses. So another thing that we've seen a lot of questions about is the second dose. So those who have received their first dose from us, they were given on their vaccination card, it will say their next appointment date. That is the target date. So like if we were administering Pfizer, it's going to be 28 days from their first dose that we will need to administer their second dose. That date that is on your card is not a definite appointment. Staff will still reach out to those people to schedule an appointment, but that is the target date. So it may be a little bit before, it may be a little bit after, which is well within the guidelines from the manufacturer for administering the second dose. So we will reach out for that second dose appointment. So just to clarify that, it's been lots of questions on social media. We've received lots of calls and emails about that. So if someone does not reach out to you within 48 hours of when your dose should be due, then you can call the health department and just make sure that nothing fell through the cracks. That would be perfectly fine. We just want to avoid a lot of calls right now to say, when is my appointment, because you didn't put an appointment time on here. That wasn't intended to be an appointment date. So we apologize for the confusion on that. We're working to put something different on those cards where it's hopefully a little bit less confusing for this next round. So each time we're learning a little bit more about what will make this more efficient, and trying to improve on this next go around. There's also been some confusion about the confirmation screen. So we've had a lot of people say, I signed up and I didn't receive my confirmation email or my confirmation text. So to clarify, that little screenshot that was put out, I guess either last week or the beginning of this week, That is not going to come in the form of an email or a text message or anything like that. It is a screenshot of once you hit submit on that Google form, then it will pop up with that message to say that, you know, your response has been received. Now, if you signed up prior to that first week of January, you would not have received that confirmation. So that was something that was implemented, I think, around that first week of January. And so a lot of people have been confused about that I didn't see that screen. If you signed up prior to that first week of January, you would not have received it because it had not been implemented yet. So hopefully that clears that up. Another thing that I've received lots and lots of calls and emails, people who have watched maybe some of the news footage, seen some pictures or whatever, people posting on Facebook that they had received a vaccine or something like that. Many of the comments that I'm receiving are, these people look young and healthy, and why are they being vaccinated prior to my 95-year-old family member or something like that? As a reminder, we are still vaccinating 1A people. So these are healthcare workers. These may appear to be young and healthy people, but they are still eligible to be vaccinated. And so we want to make sure we're continuing to vaccinate the 1A people. They may appear to be young and healthy, but they're the ones that are your home health nurses. They're the ones that are working in your long-term care facilities. They need to be vaccinated as well. So we don't need to send an email to inquire about why they're being vaccinated prior to your elderly family member. And there are many people who have a chronic health condition. You can look at them and they appear healthy. We don't know what's going on with them. So please don't send emails about that. We are doing our due diligence to make sure that we are vaccinating people that fall within the 1A and 1B category. It just bogs down voicemails and emails, and we're unable to respond to all of those. So that's really, those are kind of the main things that I had put down to talk about. I also did look at our county dashboard, which I have access to, and it does say how many doses had been allocated within Taylor County. That number is 13,975 doses. I'll say that again, 13,975 doses have been allocated within Taylor County. And as of this morning, there have been 8,354 doses successfully administered. Now, keep in mind that this may be a little bit behind. It requires data entry after the fact. And so after a vaccine is administered, then staff has to go in to do the manual entry of that information into the state's MTrack2 system. That's the state database for vaccinations. And so there may be a little bit of lag there. The majority of those doses were given to Hendrick. That includes the first and the second doses. They have well over 5,000 employees, and so they're still working on continuing to vaccinate their employees in that 1A category. So, and then here at the health district, we've been allocated to date between first and second doses. I think it was a total of 3,600 so far. And of course, we'll be administering the 1,200 on Friday. So those have not gone out yet. So what we're telling everybody right now is you need to answer it if you've got your name on the waiting list. Certainly, if it sounds suspicious or anything, that they're trying to ask you for money or any personal information, hang up. It's not us. We are working to resolve that by implementing a new electronic system. And I know it can't happen fast enough for everybody else. We're certainly very anxious to get it because it will make our work much more efficient. Until then, we all have to just hang on tight and do the best we can with what we've got right now. But that's all that I can advise is answer it if you're on the waiting list. Hang up if they are asking you for any of your bank account information or your personal information other than what you already provided. And we're not going to be asking for that information over the phone. You've given it to us. We're going to ask you if this is, your name, and um, offer you an appointment. So there should not be any exchange of any other personal information. And we're working every day. We're talking about ways that we could do this more efficiently. And so we may be trying different things. We may get to the point where we're going to try leaving messages. We did that in the very beginning, and it backfired. We had a lot of people who were calling much later. They did not call us back immediately, but would call later and very upset that they did not get scheduled an appointment. And we were having to say at that time, we have no idea when we'll receive more vaccine. Hopefully now that we're getting 1,200 doses a week, and that's hopefully guaranteed, which you know as well as I do that nothing is guaranteed these days. But supposedly there's a guarantee that we'll receive the 1,200 doses. And so if we can get people scheduled, maybe even for the next week's clinic, if they call back too late or something like that. I mean, we're exploring different options to try to make this more efficient for everybody. And so we'll try things and adjust as we need to. So I think that we were really pleased with the way that it went. Our goal was to get people in and out of there fairly quickly without long wait times. And I think that we were successful in accomplishing that. There were a few minor snafus that I think that we're going to adjust, but it's simple things like, maybe pre-filling out some of the cards with the information instead of having the vaccinator have to sit there and write that out for each person as they vaccinate. We'll have more people to try to direct along the way. But really, there was nothing major that needed to be done. This will be a little bit different in the fact that we've got Pfizer. And so the vaccine, by the time you draw it up, and so last time we had nursing and pharmacy students who were drawing all the doses to make that efficient, and they would just go and deliver them out to the bays so that the vaccinators could already have those syringes pre-filled. That was really successful. With Pfizer, there's a little bit shorter time frame on from the time you draw it up until the time you have to use it. So we will have someone who will be stationed there whose job it is to time bins of vaccines. So if these were drawn up at 10 o'clock, we know we need to use them by 12 o'clock. They will ensure that these are going out first. So we'll make that adjustment just to make sure that we're not wasting any doses. But other than that, tweaking little things, we'll have more people on board to help. We are doing, I think last week we had 20 bays of people vaccinating. This week we'll have 30 bays of people who are vaccinating. So I looked this morning and I think we're somewhere around 17,000. So I'll take it to council this Thursday.
Okay.
They are saying that if you don't customize it at all, that they can have it ready to go within a couple of weeks. We already know that we're going to have to customize a few of the fields. And I'm not sure how much time that will add. And then it's kind of like building a house. You can always just add a week or two to that time frame so that we don't just get really disappointed in how that went. I am hoping that within the next 3 to 4 weeks that we can have something ready to go. But, as with everything these days, we're trying to be super flexible, and we're going to continue to be as efficient as possible and troubleshoot the things that aren't working well until we get to that point. We had some vaccines at the end of the day. We actually had a few no-shows. And so we tried to call people really quick who could come and respond at a moment's notice. And we ended up having to stay later than we thought, which we assume will probably be the case with every clinic that we host. but they all got administered. Yeah, I think that there's been a lot of advocacy from every level. So I know the mayor is doing his due diligence to work the avenues he has access to. He's made calls to the governor's office. He's made calls to Senator John Buckingham, to Representative Lambert. And I know Hendrick has as well. They've been having meetings talking about the area of responsibility that they have. You know, we look at kind of a county level, but they really serve a 24 county area that is roughly 400,000 people. And so the way that the state allocates doses when they take the percentage of your population based on the entire percentage or the entire population of Texas, that's the formula, how they're allocating doses. And so Hendrick is really advocating that they take into consideration the 24 county area that they serve based on the hospital impact. So I know that those advocacy calls are going out. I have the cell phone number of some people who are on the allocation panel. And so I'm communicating with them, even if we can't get doses entered into the system quick enough to communicate to the state that we've administered all the doses. I'm sending texts over to say, hey, it may take us a day to get all that stuff entered, but we've actually finished. That way it doesn't impact them not allocating doses to us for the following week, because they do want you to get rid of all the vaccine doses that they've given you in a week before they allocate you another round. And so I'm making sure that that's being communicated so that we don't miss an opportunity to be in the allocation for that week. So I think everybody is working really hard. Obviously, you know, the problem is just vaccine production, and that's a hurdle that, you know, we can't fix just by advocating. Hopefully soon we will see some relief at the hospital level if we can get enough people vaccinated. But until then, we've got to continue to be safe, especially around those people. And I think that we tend to become complacent, especially if you're around younger people. But I've heard so many stories of family gatherings where, you know, everybody is super healthy and not concerned about themselves getting it, but they have that one interaction with grandma or grandpa or aunt or somebody, and they end up getting sick and passing away. That's a heavy burden for people to carry. We've heard those stories, and it's heartbreaking. So even if you're young and healthy, you don't want to be the one that passes it on to your loved one, which could result in death. And, you know, certainly don't want to make people fearful into complying with something, but you do have to think about what the impact of that is. Please refrain from having large gatherings, but family gatherings, honestly, this is where we continue to see those outbreaks. It's gathering for a funeral. Heard a story of they'd gathered for a funeral of someone who passed away from COVID, and everybody in the entire family ended up getting COVID. And so you may not be going to concerts and big events, but even just gathering for your family with your family can be very detrimental. And so we just encourage you to continue to put those things on hold. We're all having to sacrifice, but hopefully there's an end in sight and we won't have to do it forever, but continue to be diligent and do those things. Wash your hands. When you come home from being in public or from work or going to the grocery store or anything, immediately go in and wash your hands, and stay home when you don't feel well. We're relying on our community partners to put the word out. I met with the Basic Needs Network last week, which is a very large consortium of people in all various roles, and they deal with a lot of the counties around here. So we're working on trying to get information to our community partners to help us. It's a very difficult task to do all the things we know we would normally do when trying to implement any sort of public health programming. And Public Health 101 is you want to try to reach out to those communities that you're targeting. When we've literally got staff working every day of the week, well into every evening, just trying to stay afloat with COVID response and all the different activities we're doing to continue with contact tracing and to plan mass vaccination clinics and keep up to speed with everything that's going on at the state level. There aren't enough hours in the day, and I don't have enough staff people to do the things we know we need to do. That's where we rely on you all in the media. It's where we rely on our community partners who have contact with those outlying areas, the rural communities. And we need you all to spread the word. We want people to sign up on on the waiting list. We want to start vaccinating our rural communities, but we need help getting that message out. If they call the news station, you can pull up the form and you can take their information for them. I don't know. Everybody can help. But it literally is just talking through them. You know, do you have a son or daughter? And maybe they don't even live here in Abilene. They can do it from anywhere. They can live in California and they can still go to our website, pull up our form, take mom and dad's information over the phone, put it into the computer, hit submit, that signs them up. So, you know, even just questioning people about who do you have that you could call that could help you fill it out. Sometimes just thinking through that with them and identifying that person and explaining simple things like that is helpful. But in the end, they can always come here. We've got printed forms. If they fill it out here, they've literally got no other option. We've had people show up here. We give them the printed form, they handwrite it, they give it back to us, and we have staff who enters it on their behalf, and it puts them on the wait list. The library has graciously agreed to help. If people go into the library, they've got the computers there that they can help them fill out the form as well. So many different options. Yeah, I've heard of a lot of people assisting. Last week, I think I encouraged church groups. You know, this might be something that if you have elderly people in your church, even if they haven't been attending services, which a lot of them are not now, reach out to them and offer assistance. That could be a great project for, you know, a group, a life group, or a Sunday school class or something like that. Is just partner with some of your elderly people and make sure that they understand what to do and help them do it if they don't. I think that we're managing as best we can with the resources, the tools that we have available. And I've also, you know, borrowed staff from like the police department, the fire department, the airport. They've loaned me staff and they've been making calls periodically throughout this entire time as well. And so hopefully with all of the other departments within the city, when I see that I need additional help, I've been able to reach out and they've responded very well to get me the resources that I need. So I'm sure that will continue. Thank y'all again for helping us get our messages out.